Hey everyone, I'm Dr. Caroline Cunningham, and I'm here to talk to you today about one of our favorite products here at Premier Dermatology, Botox. So Botox is a medication that's injected directly into the muscle and works to decrease the amount of contraction and movement that muscle has, and in doing so, softens lines and prevents the development of deep wrinkles in the skin overlying those muscles. So we all love Botox for those classic uses, softening those forehead lines and softening the lines between and around the eyes. But did you know, in the hands of the right injector, Botox can be used for many other purposes and procedures throughout the face. So today, I'm gonna take you through some of those unique uses for Botox. Starting kind of at the top of the face, we have the Botox Brow Lift. So with the Botox Brow Lift, we're really injecting those muscles that kind of pull down on the brow. And by relaxing those, we allow the muscles that pull up and elevate the brow to really do the work and give you just a nice eye-opening effect and a great overall lift. Moving down a little bit on the face, we have the bunny lines. And the bunny lines are those lines that some people have when they smile or when they laugh, and they're those vertical lines on the nose. And with Botox, we can inject the nasalis muscle, which sits right on the nose. And by injecting and relaxing that muscle, we prevent the formation of those lines. Moving down a little bit, we have the Gummy Smile. So with the Gummy Smile, some people, when they smile, they just elevate that upper lip a little too much and show a little bit too much of that upper gum line. And so what we do is, again, just a very small amount of Botox injected into 2 points, and that's injected into the muscles that elevate that upper lip, just to drop the lip slightly so you show less of that gum line when you're smiling. And it's just, again, a small amount of Botox drops that lip just slightly and really doesn't change the overall shape or look of your smile. And sticking kind of with the mouth, we're gonna talk about the Botox Lip Flip. And this really addresses the muscle that completely surrounds your mouth. So everyone has that muscle, it's called the orbicularis oris. And just putting a small amount of Botox around the mouth really relaxes that muscle and allows the lips to flip up. And just a little bit of extra show for those lips. And it's a really beautiful, nice, subtle enhancement for the lips. Moving to the corners of the mouth, and everyone has these muscles that kind of pull down on each side of the mouth, called the depressor anguli oris muscles, or the DAOs. And injecting those muscles and kind of relaxing those allows the corners of the mouth, rather than naturally pulling down, to naturally go up on the edges, which is a really pleasant, really beautiful enhancement. Moving away from the mouth now, back to the back of the jawline, and that's where the masseter muscle sits. So the masseter muscle is this kind of bulkier, larger muscle that sits right here, and you can kind of feel it if you bite down or clench your jaw. And by injecting that muscle with Botox, we relax that muscle. It can prevent teeth grinding and jaw clenching, and then also just over time causes that muscle to shrink down and actually slims down the jawline and the face. And then finally, we have the platysmal bands. So the platysma is this muscle. It's a large muscle that kind of runs all the way from the jawline down the neck. And by injecting into the larger part of the muscle, the platysmal bands, we actually can define the jawline, soften the overall neck, and prevent the formation of those transverse lines that form kind of over time. So these are some of the not so common uses for Botox. So if you've never heard of any of these before, come on down, get a free consultation with one of our expert injectors, and see if one of these procedures would work for you.